In connection with the patient from Nagaland who was tested COVID positive at Guwahati, in this regard, we are in receipt of a report from the Superintendent, Guwahati Medical College Hospital, that the patient was initially tested positive for COVID-19 upon admission to GMCH. The subsequent second test was negative, and the third time he was tested positive again. As of 3 p.m. today, 23rd April 2020, a total of 543 samples out of 607 sent from the state have been received and all have tested negative. Issues have been raised on the quality of equipments being distributed to the districts. The department cannot afford to risk the lives of the healthcare workers who are the frontline warriors in this battle against this disease. The state government is giving full support to the department in the expeditious completion of the biosafety lab, and the department is pressing hard to enable the state to begin testing samples for COVID-19 in Nagaland within 20 days from today. The COVID-19 crisis has brought to light gaps in the healthcare delivery systems in the state to meet such an eventuality, including infrastructural and human resource constraints. Having said that, the state government and the department is also making all out efforts to address the various challenges confronting us to ensure the safety of the citizens with the strong support from all sections of the society. In connection with the patient from Nagaland who was tested COVID positive at Guwahati, the department has been in touch with the Guwahati Medical College Hospital to inquire about his health status. In this regard, we are in receipt of a report from the Superintendent, Guwahati Medical College Hospital, that the patient was initially tested positive for COVID-19 upon admission to GMCH. The subsequent second test was negative, and the third time he was tested positive again. Presently, the patient is said to be stable, and he has been shifted from the ICU to the isolation ward for further observation. A fourth test is due in few days.
Patient was having other illnesses rather than this COVID infection, because he was having pancytopenia and all these, so many complicated cases are there. So in the process, it was thought appropriate, I would say it was appropriate to think that to refer him to Guwahati Higher Center where they can do better job. So that was the main main reason why it was first referred to this Guwahati Medical College. In fact, it was Apollo, to be frank. But in the meantime, that patient himself has already arranged to go to Guwahati. That was the main reason why it has happened like that. So it doesn't mean that Nagaland doctors refuse to take the patient, or it's nothing like that. There were a lot of apprehension and media information came out with lots of accusations or like that, but initially it was the main diagnosis was not on COVID. So that was one thing I just want to clarify to you. But whatever it is, it would have been much better if this case has been, first sample has been collected from the state. So I think I don't want to go more further than this, but this was the main reason.
Positive, neither all tests would be negative. Sometimes negative results do come also. So this is all within the realm of positivity and negativity. So it's sometimes some tests do turn to be negative, but then for all measures, for all precautionary measures, and in exercising abundance of caution, repeated tests are done, and that is at the discretion of the treating doctor.
So now the fourth test, will it be a final one or further test will be required?
That will be decided by the treating doctor.
Has all arrived and work is going on in full swing. We can assure you that the workers are working overtime to ensure that we finish this at the earliest possible time. We are expecting some consignments again, both for BSL 2 and BSL 3 in the next 3-4 days. With regard to the surveillance activities in the containment zone in Dimapur, over 5,000 persons have been interviewed, covering 909 households as of 23rd April 2020. So far, all samples, that is 382 samples, sent from Dimapur district have tested negative. For the whole state of Nagaland, as of 3 p.m. today, 23rd April 2020, a total of 543 samples out of 607 sent from the state have been received and all have tested negative. Till date, the state has received the following items: 56,000 PPEs, 276,000 triple layer masks, 42,000 N95 masks, 11 ICU ventilators, 9 transport ventilators, and 50 CPAP machines, 1,007 B-type oxygen cylinders, 119 A-type nitrous cylinders, and 54 jumbo oxygen cylinders through various consignments. Issues have been raised on the quality of equipments being distributed to the districts. The department cannot afford to risk the lives of the healthcare workers who are the frontline warriors in this battle against this disease. All the districts have been informed to come to the directorate to choose and select the equipments in stock by themselves. The state government is giving full support to the department in the expeditious completion of the biosafety lab, and the department is pressing hard to enable the state to begin testing samples for COVID-19 in Nagaland within 20 days from today. The department appreciates the cooperation of all the citizens of the state during this period of the lockdown. These lockdown measures are very crucial as they ensure norms of social distancing and thereby help in breaking the chain of transmission. However, the department also understands the hardships being faced by the people without easy access, especially to healthcare units, physicians and pharmacists. To this end, the department has partnered with the Nagaland Medical Council for providing OPD services initially at Kohima and Dimapur, and depending upon the availability of volunteers, similar facilities will be made available to the citizens in other locations and districts.